minutes after 2, so why don't we go ahead and get started. I want to thank Stoughton Health for being here. I'll let you introduce yourselves because you know your specialties, and thanks everyone. I'll be turning off my video and sound now.
All right, hello everybody. I'm Dr. Aaron Schwab, General Surgeon at Stoughton Health, also their Chief Medical Officer, and I was asked to come on and just tell you that we're very excited about the urgent care opening in McFarland, and I think my job is to tell you a little bit about what some of the physician services that we offer at Stoughton Health. So speaking for myself, as a general surgeon, we do the bread and butter general surgery stuff, obviously the hernias, gallbladders, appendixes, colon surgery. I have kind of a soft spot in my heart for breast cancer, so we have built a breast cancer program at Stoughton Health as well. Two of our more successful programs that we have there are our vein program. So you may have seen advertisements about our laser ablations, and we also offer sclerotherapy, and our LINX program, which is for reflux. So we've been doing the LINX anti-reflux system for a couple of years now, which I personally think is a huge upgrade from the Nissen and fundoplications that have been done for decades. And we've got a pretty robust patient experience so far with almost 40 patients, and really have had great feedback from the patients about that. We also have a wound clinic in Stoughton with a wound nurse 3 days a week. And so I supervise that as well. And that is pretty much what my practice involves. I heard that Dr. Ravel and Dr. Graney were unable to make it. Dr. Ravel is our orthopedic surgeon, and he specializes in shoulders, knees, and hips. He does do the conformist knee, which is a custom knee, where pretty interesting stuff where they do a CAT scan of someone's knee and then build with a 3D printer the exact fit for their custom knee. So he's doing that as well. And Dr. Graney is our podiatrist, and well, he's an independent podiatrist with privileges at Stoughton Health, but he's doing his practice is picking up, and he's hoping to have a lot higher volume at Stoughton. So he is also foot and ankle certified with a foot and ankle fellowship. So go the belt line. Okay. So we are happy to have him as well. Amy, is there anything else you can think of that I missed?
No, and Teresa hopped on, so we can let her take it from there if you need to monitor your student driver.
All right,
Dr. Schwab got it all. Actually, I was going to comment on orthopedics and podiatry, but you got them. So I can hand it over to you, Amy.
All right. Well, thank you again for McFarland Library for letting us come and talk a little bit about our services and some new and upcoming things going on at Stoughton. I think there was a request for some COVID updates too, and as you may know, that has been the focus for the last 18 months here at the hospital. Right now, the COVID positive cases throughout the United States and including Dane County are lower than they have been. They've had 3 consecutive weeks now of declines in their positive cases, which is really good news. And it's at the lowest it's been since October. So again, some really good news that way with positive cases. And that probably is primarily because of the vaccines getting out and about. Stoughton has been doing some vaccines at the hospital, but unfortunately we have seen a little bit of a decline in that. Right now, across the United States, greater than 65 years and older, that population has a 69% vaccination rate. And the 18 and older has a 40% vaccination rate. So US wide, we have only achieved so far, and this is full vaccination rate. This is not counting just folks with one vaccine, but we have almost a 32% vaccination rate United States wide. In the state of Wisconsin, and particularly in Dane County, we have 46% of our folks fully vaccinated. That means they've had both the first and the second shots. and 60% with the first dose. So we are really proud of the work that's being done in Dane County and really happy with what Stoughton's been able to do for our community and surrounding communities, and perhaps some of the McFarland folks were able to travel down to Stoughton to get their vaccines with us. We are looking to still continue to push vaccines, obviously. You may have heard on the news the herd immunity. We'd like to see United States percentage of 70 to 80% in order to reach that herd immunity. But we still have a little ways to go, obviously, since I mentioned that we were at the 31%. Going back to the new cases, what we are seeing now is a slight increase in positive cases among the kids that are less than 18, which kind of stands to reason. We have more students back in school, more sporting events. People are, in closer contact that way, and that is a group that is just starting to get vaccinated now. My understanding is that hopefully within this week or next week, Pfizer will be able to push out their vaccine for the 12 to 15-year-olds. So again, making some steps to get as many people as possible vaccinated, but still have a way to go. With that being said, there have been a lot of different changes with the emergency orders that have been put out by Dane County and Public Health. And really, if you're vaccinated, if you have fully vaccinated family members, you can feel safe that you can be unmasked in gatherings if everyone is fully vaccinated. The best practice is, because we have we don't have quite that herd immunity number, is even when you're outside, if you cannot maintain social distancing of 6 feet, is to stay masked. If you can be in gatherings where you can be a little bit more spread out and you're vaccinated, then it's fine to take your masks off. But if you cannot maintain that social distancing, there's still, the CDC and public health is still saying that the best practice is to stay masked if that distancing can't be maintained. So again, we have information posted on our website if you're interested, and CDC and public health for Dane County keep a lot of information updated as well. More exciting news, though, coming to McFarland that we're really excited about is the opening of our urgent care. And hopefully if you've driven down 51, you've seen that we have our urgent care sign up next to the Walgreens store that's in your community already. Work is being done with the intent that we will be moving in and having our first opening day on June 9th or June 8th, I believe. The area itself will have 4 exam rooms and a full imaging suite. So really we'll be able to handle any of your urgent care type needs that McFarland folks are experiencing and maybe having to drive elsewhere for. The hours of that urgent care will be 8 to 8 during the week and 9 to 5 on Saturday and Sunday. And it'll be staffed obviously with an RN and a PA, and also a medical tech, a registration, and folks able to do different laboratory procedures. So just really excited that we can extend our blueprint, or footprint, I should say, from the hospital into another surrounding community and provide McFarland folks with healthcare close to home. So I think that is all I have to say. Teresa, I don't know if you have anything else that you want to add, but that probably is our biggest updates from Stoughton Health at this time.
I think you hit it all, Amy. Thank you. Any?
If anyone has questions, please type them in the chat down at the bottom. Maybe we'll just give it a minute or two, but thank you so much for Stoughton Health for being here. And let's see if any question pops up. Well, I'm not seeing any, but thank you so much for being here. That was a very helpful overview. And while I, of course, hope no one needs to use the urgent care, it's wonderful to know that will be available in McFarland. So thank you so much. Oops, I'm sorry, you're still muted. Let me get that.
I was just going to say thank you. I just said thank you for allowing us a few minutes to share updates from Stoughton Health.
Oh, you're welcome. Take care, everybody. Bye now.
Bye-bye.